Welcome, everyone. I'm Melinda Taschetta-Millane, Market Content Director for Healthcare Innovation. And today I'm joined by Dr. Richard Staynings, who's a globally renowned thought leader, author, public speaker, and advocate for improved cybersecurity across the healthcare and life sciences industry. During our upcoming Healthcare Innovation Summit, which is taking place in Washington, D.C. on May 12th, Dr. Staynings will be presenting on what happens when the light goes out, which will cover disaster medicine when a hospital or critical vendor is under attack. And he also will be participating in our CISO panel, covering critical topics facing healthcare organizations as they expand their digital and AI footprints. So thank you for joining me today, Richard.
Thank you for inviting me, Melinda.
So, Richard, when you're in Washington, you'll be talking about cybersecurity and healthcare. From your perspective, what's happening right now that's making this such an urgent topic?
Well, I think it's a combination of things. I think we've got so many pieces that are in a state of flux right now, so many dynamics that are in a state of flux when we look at things like threat actors, threat vectors, attack vectors, and our ability to sustain attacks. We have a vastly expanding threat surface across healthcare as we add AI applications, AI-enabled applications and clinical and business functions. We're adding medical devices at a huge clip and other healthcare IoT systems. And at the same time, we're adopting a lot of new cloud services. That is all expanding the attack surface that perpetrators can use to attack us. At the same time, the threat actors, as we call them, are changing too. It's no longer just a case of perpetrators trying to extort money from healthcare systems or to monetize stolen assets. We are now facing nation-state threats that either manifest themselves with direct state actors or through criminal proxies, as we've seen with Synovis and the Synovis attack, with Change Healthcare attack, where criminal actors are essentially taking down critical components of our healthcare system. Particularly third parties, which is a huge and growing concern. So we'll be discussing the dynamics of that. We'll also be discussing the resiliency of the healthcare system to sustain such attacks, to continue to provide vital services to patients right the way across our healthcare system.
That sounds like very valuable information, especially for this day and age. Can you paint a picture for us of what the real risks look like today? What are some of the vulnerabilities in healthcare, particularly in the use of outdated hardware and software?
Yeah, so in healthcare, we have what we call a technical debt. We have not invested in up-to-date hardware and software and systems across our health services because of the lack of prioritization around resiliency, which is a subject I'm going to continue to come back to throughout the conference, is that this lack of resiliency to sustain bad things when bad things happen. And that can be for natural reasons, like a power outage, a power outage or a natural disaster, a flood, a storm, what have you, that takes out critical components of the healthcare system. We don't have redundancy, we don't have high availability, and we haven't invested in the upkeep of hardware, which in some hospital systems is, end of life. It's no longer supported by vendors. I've seen servers in hospital data centers that are literally taped together because they're so old. And the money just isn't available to replace those systems. And of course, when they go bad, when they fail, then we're up the creek without a paddle. And it's the same with software. Hospital uses a lot of different software vendors, and a lot of the systems we use for business, even for clinical sides of things, are quite old and out of date. And those present risks when we talk about the continuity of clinical care, when we talk about the continuity of business processes, of getting billed, of getting approvals from insurance, and essentially getting patients out the door in a healthy state rather than have them come back, a few months later for a readmission, which is one of the metrics, of course, that healthcare is very keen to measure.
So, for people who join your session in DC, what are one or two big takeaways that they'll leave with about protecting patients and healthcare systems from cyber threats?
So I think, we face a number of very dynamic cyber threats right now that potentially place patients at risk. And I think one of the big lessons that we all need to learn is how do we maintain that clinical continuity? How do we maintain healthcare services to patients in adversarial times, right? So when there's a storm, when there's a flood, when there's a power outage, these sorts of things, or whether there's a cyber attack, right? And that relies upon nursing staff, clinicians, or hospital staff, essentially, being able to revert to a disaster mode, right? To provide that continuity of care. Now, whether that is, pulling out pens and pads and manually charting patients when computer systems are down, whether it comes down to learning new skills that perhaps have been forgotten since the 1960s before technology entered our health system, right? To diagnose, monitor, manage, and treat patients without the intervention of advanced artificial intelligence and medical device systems, right? We need to relearn those skills, and we need to be not just adept at using them, but highly proficient at using them, because we've seen what happens when IT breaks down. We are now entirely reliant upon the IT infrastructure that we have built across our healthcare system, and we have one of the best healthcare systems in the world in terms of its ability to diagnose, monitor, treat, manage patients. But that is reliant upon the technology that underlies it. We need those manual human skills and processes to be resilient in the same way that our IT systems need to be a lot more resilient than they are to sustain the sorts of cyber attacks and other disasters that potentially befall us.
Those are all very excellent points. So thank you so much, Richard. I'm really looking forward to learning more during your sessions, and I invite everyone to join us at the next Healthcare Innovation Summit. Thank you so much.
Thank you.
Great, great. Was there anything else that you wanted to add that I did not ask, or that you?
No, I think it's good. I think it's good. Yeah.
Okay.
Yeah. Yeah. I obviously are going to cut it up a little bit. But yeah, I think that's a good little advertiser, good little teaser.
Excellent. Well, I
Yeah.
sure appreciate your taking the time to do that. And I guess once we get this ready to go, I'll let you know what we'll be doing with it and where it will be posted so
Yeah.
that you
Yeah,
can.
let me know, and then I can boost it with my 26,000 followers
That would be
or whatever they are.
wonderful. That
So
would be
yeah,
wonderful. Thank
yeah,
you.
my pleasure. And look
Excellent.
forward to seeing you in
All right.
Washington, DC.
Absolutely. Thank you so much for your time. It's been a pleasure.
My pleasure. All right.
Take care.
Take care, Melinda. Bye now.
Goodbye.